So I'll start today with the discussion on the evacuation project and public health literature review and pilot study. The study was actually initiated by a student. Her name is Marie-André Peel, and Emmanuel Bouchard-Bastien, Julien Michaud-Tétrault, and I are the ones who continued through the project. So thanks to all those people to make the project possible. This project, as I said, was initiated by Marie-Audrey. She was a medical resident at INSPQ, and Julien Michaud-Tétrault was a fellow working with us, and Emmanuel Bouchard-Bastien is an anthropologist working with us also. It was conducted in response to a collaboration request from the Centre Régional de Santé des Services Sociaux de la Baie James, who experienced a lot of the evacuation and wanted to have a deeper look to what are the issues that came about after the evacuations. Here, it's important to say that the findings we have here, they represent the work of the authors, but they have not yet undergone peer review. So, but we still are in a certain hurry to present them before the wildfire season begins. And so if there's important findings or whatnot that could be useful for anyone present here, we'd like to share them with you. So I'll start with the key findings. I'll come back with them at the end. The key moment in the evacuation process was really at first with the communication and acceptance of the evacuation order. So that's actually a critical control point. Another critical control point is really the adapted transportation and everything that's related to traffic congestion. The third critical control point is really the temporary accommodation. And the fourth is recovery. So there's things to be done at each of these steps. Two types of populations are particularly affected, but they're not the only ones. That's especially during the evacuation process. So it's the elderly living in long-term care facilities or at home with disabilities, and the essential workers and firefighters facing professional and personal challenges. It's important to state that there's measures that needs to be implemented at all stages of the evacuation process that could help to mitigate impacts on the population. So the plan of the presentation, first, small context of the 2023 wildfire season in Quebec. Secondly, a short note on the methods we used. Third, the limits. And fourth, the results from the literature review and the pilot study. So the fire season in Quebec actually caught us all off guard in 2023. Even though down west, you're quite used to having, unfortunately, fires, it was not at all the case in Quebec, and it was difficult to forecast with the data we had that the 2023 season would be as severe as it became to be. So, as you all know, wildfires are integral to the ecosystem in Quebec. They contribute actually to regeneration and biodiversity. The forest covers a lot of territory in Quebec, 1 million kilometers square, so it's more than 50% of its area. It's actually mostly coniferous forest that unfortunately are much more flammable. And historically, large fires bigger than 200 hectares are quite rare, but they still accounted for a large part of the burnt area. So what happened during the summer 2023, we had more hot and dry days. We had an increase in storm activities. Unfortunately, we did not have a lot of rain, and the snow cover disappeared quite early and appeared later also from in the previous season. And the other thing that is a challenge is that the human populations are more and more intertwined with the forest. And since 1959, we did observe an increase in average burnt area, more than double, but then again. And if we look at what is forecast in the future, whatever the scenarios, there will be more area burned in Quebec. And actually, it's possible that we could become the most vulnerable region in Canada, not in terms of intensity, but in terms of populations that are near or within the areas where there will be more wildfires. So again, summer 2023, early start. By June 1st, 120 fires were ignited by lightning. By June 6th, 4 towns that had already been evacuated. Mid-July, a fifth town was evacuated, and the evacuations lasted quite a long time, from 1 to 4 weeks. Here you can see that when you look at 2023, the blue lines, you see that we had a lot of, as of September 23rd, 2023, we already had more than 5 million hectares burned, and usually it's 0.2 hectares for the 10-year average. So you can see that we were really caught off guard. And you see the areas here where actually there was more burnt area in Quebec. So I'll start with the second part, method. So what we've done is we decided to go to have semi-structured interview with key stakeholders between August and November 2023. We had an opportunity window because it was basically spaced events. We also had reduced memory biases because it was close to the event. And again, our objective was to support public health authorities in their preparedness and interventions regarding wildfire-related evacuations. So we wanted to have the experience. We wanted to discuss factors influencing stakeholders' experiences. And we wanted to identify the perceived or experienced health impacts also that came with the evacuation related to the wildfires. We also perform a thematic review of the literature on the critical control points that we identified in the pilot study. It is more or less a pilot study, and it's exploratory in its scope. It's a qualitative approach with semi-structured interviews. So we had 3 different themes. We looked at, it's a typical evaluation process where you look at the structure, that is the resources available for the evacuation management. We look at the processes, the services produced during the evacuation, and the outcomes, the effects of evacuation on health. Our sample of stakeholders, we recruited through the public health department. We used the snowball approach also. We conducted 12 interviews, each lasting about an hour. There were some participants that worked in 2 organizations, but we had all in all 2 community organizers. Those individuals are specialized in working with different groups in the society. We had firefighters, civil security officers, municipal employees involved in civil security, so we had 5 of them. We interviewed also 7 people from health and public health services. And finally, we talked to 5 representatives of towns in population varying between 150 and 7,500 with mandatory evacuation. None of the interviewees belong to First Nations, however. So the data analysis was conducted in 3 stages. We did a thematic summary that was completed from a team member during the interview and while re-listening to the recording. We coded, of course, the forms afterwards. And we had a descriptive analysis, which is we're still finishing up on some details. The limits, again, ongoing analysis, and they may not represent the full range of key findings. The results are exploratory, and the saturation has not been reached. And it's one of the many reasons why we went also through a thematic review. Further research is still necessary. And wildfires were major events that mobilized numerous organizations. So we had a sample of 12 participants. So it's probably not representative of all stakeholders. And the other thing is, despite our efforts, because of ongoing wildfires, because the wildfires went quite a long time up north, it was not possible to recruit participants from First Nation. And again, their experiences, whether common or distinct, are thus missing, unfortunately. We made sure that the interviews did not replace debriefing sessions that occurred within the various organizations, civil security. So we also discussed with them to make sure that there was not crossing of interviews. So here are the results. So the results will always be divided in 2 parts. I'll present first the results from the literature review and then the pilot study. So in terms of the evacuation order, the first critical control point that we identified, if you look at the literature review, the decisive factor for evacuation is the physical danger of wildfire. It's actually never smoke unless the smoke compromises any further ongoing attempts afterwards to evacuate. So if people cannot access the town by plane because of smoke, so the main reason was always the danger of the wildfire. The other thing is the wildfire has unpredictable. The fires, as you all very well know, is very unpredictable. So you have rapidly changing decision-making parameters because of that. So one day everything is fine, the next day you almost have to evacuate. That creates a lot of stress and uncertainty. In the literature review, we had a case study that was a series of case studies in California that were quite interesting, where where in California you do have mandatory evacuation orders like you had in Quebec, and it was observed that between 3 and 13% of people did not follow the evacuation orders for various reasons. The reasons that were evoked were they did not receive the evacuation order, they refused to leave because the main reasons often was the desire to protect the property. The refusal to leave pets or farm animals was often stated. Fear of traffic. Also, insufficient financial resources for evacuation. No acquaintances to stay with. And refusal to go to a shelter was also something that was common there in California. So again, the literature review regarding evacuation, you look at communication. That's actually good news. The governmental agencies and local spokesperson are often perceived as more reliable. There is a greater mistrust towards social media. Again, literature review for regions close to or at direct risk from fires. The information usually which is thought relates to the fire, not to the smoke. But often sometimes the messages are contradictory. So for example, you can have messages that say to people, stay inside because of the smoke. And in the same message, you'll have in the same sentence, almost you'll have message that secure the perimeters of the home in case you have to evacuate, in case the flames come about. Here, those are the results from the pilot study. Again, here in Quebec, it was the same thing as in the literature review. The decisive factor for evacuation was always the physical dangers of wildfire, either direct or because they would impede access routes. We've noticed also one big issue was the conflicting professional and personal dimension for workers. To give you an example, the workload and the coexistence of personal and professional and personal dimension. So I'll read the comment. I have the original comment in French so that you'd see if it's you could see the real verbatim. But as I translated, it's because I've experienced it. It's not easy in a situation like that when you have 8 people and 3 of them can't cope and decide to go be with their family. Then the team is already small, and when you cut your workforce almost in half, the challenges becomes even greater. And here again, we have evacuation orders in the pilot study. What were the big issues? The majority of households here accepted the evacuation order, like in California, but not always. There were challenges regarding the acceptance of the evacuation orders, and there was also here increased mistrust due to contradictory messages. You had anxiety towards authorities also, which seemed to be a residual effect from the COVID-19. And one of the contradictory message we had, for example, is that because of the very varying nature of the wildfires, one day there's actually it doesn't seem you'll have an issue, and the next you'll have an issue. So when people go on the radio and local spokesperson and say, well, I'm not afraid, everything's okay, everything's going to be fine. And the next day, everyone has to evacuate, then it becomes a big issue. And that's a clear and present issue that many of you, if you share that experience, might have experienced also. So that's something that actually creates mistrust. Uh, Again, findings from the pilot study. Uh, Other challenges, resistance among farm animal workers. You probably won't be surprised if I tell you that. Uh, of course, the farmers will face difficulties because of the livestock and the challenges associated with transporting animals. So that's a big issue, and it's also it's also their job and their life. Also, another big challenge is the demarcation of evacuation zones in rural areas. So where do you leave, where you not leave, and when people live in adjacent area, it can be an issue when one leaves and the other one stays. So, and it's actually quite complex due in part to the vast geographical area and diverse land use. So, and also there's also the issues of effectively communicating the urgency and boundaries of evacuation zones. There's also confusion about risk communication in terms of perception of vulnerability. So just to give you an example, the public health messages in Quebec often emphasize air quality issues, leading an individual with respiratory problem without any respiratory problem to feel no urgency to evacuate. So one quote really illustrates this when you and I'll go through it. Uh, the way the communications were made was always to say that it's the air quality that's the problem. So those who didn't have not have respiratory issues did not want to leave. Again, findings from the pilot study. Uh, Psychological impacts include stress and fear related to potential material loss and safety concern. And just to give you an example from a quote, I got chills. It was like the end of the world. The scene was truly apocalyptic with very dense orange yellow smoke and the reflection of orange fires close to the city. People lined up at the gas station to refuel. It didn't just smell like smoke, it smelled like fire. So these factors that collectively highlight the complexities and barriers in emergency response efforts. So you see that it's not really easy also. Transport, the second critical control point. So look, that's results from the literature review. So in terms of observed risk, uh, when you have people that already have a cognitive issue, especially people that are older and in long-term care, often they'll be disoriented. And the issue is when you go to the transportation, when you have the transportation, you need to have proper medication, you need to have water, you need to have food, you need to find you may not find a way to compensate for sleep, but all of those issues they have to be planned in advice and in advance. And it's an issue that was seen in many evacuations in the literature where it wasn't planned in advance and problems did arise. The other thing that was seen in the literature is the importance of caregivers and support network directly involved in the transportation process. Whether often, if you have again, if you have to evacuate long-term care homes, or you need to have the caregivers in the transports in the buses and whatnot to help people there, and that in literature you'd seem to make a big difference. Interestingly or not, road congestion, I did not see a study which did not present it as a problem. It was present in all of the studies and I'm sure there's must be an example where it wasn't the case, but not in the studies that I've seen. So it's actually the rule, not the exception. So it's always important to consider this congestion and evacuation of vulnerable individuals. The other thing in the literature review is the issue of domestic animals. People do not want to leave their domestic animals at home, and it actually makes sense in many ways, of course, for those who have domestic animals. And it's a big mental burden if you leave your animal and they're at risk, and you come back and they're not fine. So it's really something that has been in the literature review that people did talk a lot about. those are findings from our pilot study. So we did find, of course, the issue of congestion and very long travel times, sometimes at night. Uh, the other thing is there were long waiting times between the time people were ready to leave and their departures, especially if it's public with buses. There was issues with adapted transport for people with disabilities. Often the buses were not available and were far away. The other issue was the availability of drivers. Sometimes they were not available also. And for people that are vulnerable, when you have multiple destinations, it's also an issue. And you did have lack of access to toilet, food. If you're in the middle of the road and there's a lot of congestion, that is an issue. Uh, and however, often there were the original healthcare personnel and medical support team were in the original place where people lived, were in the buses, and that was perceived as very positive. So road transport was associated with various risks. So one of the risks again is to have adapted transport with people with disabilities, and it's not as simple as one may think because you really need a lot of apparatuses to bring people with disabilities in buses. And also people with neurocognitive issues, dementia, it could be a really big issue. So it's basically what we observed was disorganization among some passengers during transport because they were confused about what was happening in the middle of the night. Also, population with varying medical needs, that was an issue that we also identified. Domestic animals, we had people that refused to take the buses because there was no places for the animals and took the car at their risks also because some of them often were quite old and it can lead to accident and other issues. Our third critical control point, temporary accommodation. So here in the literature review, what was noticed is most people, they went and lived with acquaintances, some with family members, others hotel and motels, many in recreational vehicles, public shelters, uh, sometimes short-term rental platforms offer uh, uh, free shelters, and that was actually taking a lot, as we've seen in the literature review. What has been shown also in the literature review was the importance of the importance of the Red Cross. Temporary accommodation, that's the findings from our pilot study. So here we've noticed that many households, they went to family members and caregivers. However, one town was evacuated twice, and it was more difficult the second time for the caregivers to take care of their relative, especially if they were very they needed a lot of care. Also, motel, hotel, hospital, and long-term care homes, arenas, and multi-purpose facilities. Also, that's another area where people went. Also, we've seen in our study that free short-term rental was something that people used, and also we found that the Red Cross was also quite important. What we found also is that the social impacts were not all negative. Some of them were quite positive. New bonds were formed. Those who were housed at the hotel, it created kind of new energy. These people got to know each other, develop connections also. We've noticed also spontaneous acts of solidarity and mutual aid. Those who had cognitive issues, well, they had visitors, so they took up a trip. They saw family they hadn't seen in a long time, so people were reunited. However, sometimes there were minor conflicts and substance abuses, especially where you had shelters with many people. Also in our study, there were also negative psychological impacts. So especially stress, anxiety, and worry and distress related to the progression and evacuation, and also the lack of information about ground information. So people feared vandalism, material losses, the safety of loved ones. oh my God, it's dangerous. Like, are we going to be caught in the fire? Are we going to lose our town? Am I going to lose all of my belongings? So those, of course, were questions that people ask themselves. Challenges, shelters were a challenge, uh, because often the most vulnerable, the ones that are isolated, will also be those who remain in shelter the longest, those that don't have necessarily close family or friends nearby. And also, we've known for those that were very vulnerable, it actually increased their vulnerability. The fact that they were isolated for a long time in the shelters. Uh, the Red Cross, it was actually a good experience. They had very clear protocol for hygiene measures, but then again, there's a gap between theory and practice. And during that time, there were protocols they had to adhere to in terms of hygiene for COVID, amongst other things. And with 200 or 300 beds in a gym or arena, it's quite challenging to adhere to protocols. The also what the people in the Red Cross, what was seen is that the response tend to improve when the medical team from the original community is present also in the shelters, especially for those who have neurocognitive disorders and those with issues of mental health. Uh, because trust, knowledge, and needs are well understood, there's a good knowledge of medication, among other things, and there's a decrease in anxiety and psychological distress that was observed. Additionally, the fact that the Red Cross also have independent caregivers, it offers an advantage for those who want their problems to stay confidential. So the fourth critical control point, the recovery, what we've seen in the literature review, there's an increased mortality during the evacuation of highly vulnerable individuals, such as those in residential care homes and long-term facility, possibly extending up to 4 months post-evacuation. And that was actually the result of a high quality, I find, meta-analysis of many different evacuations, not necessarily only fires though, but it did show that, again, uh, mortality when you're evacuated and you're highly vulnerable, uh, you will have an increase in mortality. Uh, there's also during the recovery phase, psychological impact and financial instability for those that were evacuated, and also the criteria for return presents a challenge. So when people are out, what do you do? And that also plays. Findings from the pilot study, perceived impact of long-term care. It's perceived because it hasn't been measured, but there was a perceived increase in mortality in the weeks following evacuation here. There was a perceived increase in new clientele upon return. We brought back more patients that we evacuated. Psychological and mental health impact for the general population. It's a combination of the duration of the evacuations plus material losses, because a lot of people lost their hunting cabins, their chalet, and that contributed to stress and distress, and also a feeling of a loss of a lifestyle, especially given that the forest was severely affected also. Uh, what was seen, sorry, what was seen also is that there was a lot of fatigue, hypervigilance, and anxiety for the future, including new forest fire events. So short and long-term socioeconomic impacts, again, what was noted is temporary financial aid is not the same as a job loss with increased expenses and food insecurity. And what was seen also was more food insecurity and increased demand at food banks. Some, like those in Radisson, relied on their summer job for their annual income, so they find themselves financially destitute for the rest of the year. Vast area of forest burned again. Stress from long-term economic impacts, forest industry jobs and businesses were really high in many areas that depend on the forest for their lifestyle and their jobs. There's a big fear of witnessing the future devitalization of this city also. And even I think about it, what will the future hold? We are a forest city, and we just lost 2 million hectares of forest. So that's the last section of the presentation, lessons for the future. In the literature review, what was stated quite clearly is that you need evacuation plans with simulation for staff that need to be developed, amongst others, for residential care and long-term care facilities, especially. There are issues with communication that needs to be addressed. Rapid and comprehensive updates about the fires must be available both during the event and for those evacuated. And that's also an issue that needs to be addressed when you're evacuating. You need to be really informed of what's going on. The importance of simple messages about air quality for vulnerable people was put forth. The importance it was also seen very important to centralize the information. So it also reduces the burden of information searching. So you have a centralized place, which thereafter what was seen in the literature. So if you have one point where people receive the information and then give the information away from one source, it's easier to be more coherent. And it's important to reduce uncertainty by being transparent and to prevent the spread of false or fake news. So if you need to be transparent, you need to be quick, you need to centralize, because you really want to keep people informed, and people, if they don't have the information that was in the literature review, if they'll get it elsewhere. All platforms must provide the same information. And also, technologies such as door-to-door or sirens should be used as supplement, especially during the evacuation. Also, it's not always possible, but evacuation orders should allow time to prepare. Again, literature review of transportation, promote public transportation, use buses to reduce congestion. Plan evacuations to lessen congestion. So you in advance, evacuations seem to go better if you already have planned how you would do it and how you're going to work with the roads, one-way versus two-way roads, work done on the roads and whatnot. Also, it's really important to plan for transport of pets, because if there's nothing, and what was stated in the literature, if you don't have anything for pets, people will readily use their cars. Accommodation, also, shelters must be well equipped with social and medical resources, should include spaces for pets. Recovery, again, medical services, including those for physical and mental health, should be available upon return. Those are findings from the pilot study. So what was stated is that there needs to be an emergency plan and resource planning, and clarify in advance the role and responsibilities of multiple actors, especially when multiple jurisdictions are involved. So you have civil services, but you also have people from the health sector, you have people from police, firefighter, road sector, transport sector. All the roles and responsibilities must be very clear. Identify in advance vulnerable individuals in the community. Plan the transportation and accommodation of pets. Plan for farm animals. And identify potential conflicts between personal and professional obligations to limit staff shortages and workload. Develop, disseminate, and most importantly, practice evacuation plans for the healthcare network, because as you all know, if something bad can happen, it will. Information and communication. It's important to identify community leaders to act as information relay, and that's also coherent with the literature, because they seem to be the ones that are the most trusted. Clarify the underlying reason for evacuation during communication, because you need to be transparent and clear. The fires are unpredictable. There are physical risks from fire. And you need the trigger line maps also, so that people know in advance what are the reasons why people should be evacuation. It may not always be easy or even feasible in practice, but that needs to be thought of in advance. Importance of door-to-door. Even in our study, what we found is that, for example, there was this guy which when one knocked on the door, he came forth and he didn't know that there was an evacuation, and the reason was quite simple. He was deaf. He could not hear anything, so he was not listening to the news and was not aware. So that's one of the many reasons why door-to-door is important. And it's also important to establish clear criteria for evacuation and return, and that diminishes the stress also. It's important to ensure continuous communication throughout the evacuation process also, and implement multimodal communication. Finding from the study, consider, if feasible possible, preventive evacuation for specific population. It seems to be counterintuitive because there seems to be an increase in mortality, but then again, the transport itself is something that poses a health risk if not planned in advance. So it's actually may not be such a bad idea. Limit the number of destinations for adapted transport. Carry out evacuation gradually if possible. That will limit, amongst other things, congestion. If possible, prioritize daytime evacuation. In terms of accommodation, again, the availability of support staff and health professional, that also arose from our study from the original environment. Provision of psychosocial support at the accommodation sites. If possible, also provide accommodation on a smaller scale. Plan for the cohabitation with pets, so that's also important. And in the recovery, emergency food assistance and financial aid, and also community healing activities are quite important. And also that I didn't mention, but from the literature review, it's one of the several areas where it's being researched on how you can help afterwards, after a traumatic event for a community. And again, it's really important to have health and psychosocial support. So I'll finish up with the last slide. Key findings, key moments in the evacuation process, communication and acceptance of the evacuation order, adapted transportation and traffic congestion, temporary accommodation, and recovery. And again, those that are most affected, elderly living in long-term care facilities, essential workers, and firefighters. But of course, those are the most affected, but other populations can be also very much affected. And measures at all stages of the evacuation process could mitigate impact on the population.